Slowing down the Omicron surge more than 2 years into the pandemic, hospitals still feeling the strain. Good evening, I'm Emily Flores.
And I'm Glenn Mills. Thanks so much for joining us tonight. New national data showing that daily COVID deaths are steadily rising to their highest point in nearly a year. The number of new cases, however, taking a different path. Doctors say new data points to a sign of hope. The daily case average dropping 18% in just the last 2 weeks. As the country crawls its way out of the surge, doctors once again urging more Americans to get their boosters.
Well, this comes as the Omicron surge continues to tighten its grip on the healthcare system in Utah. ABC4's Nick McGurk joining us live in Salt Lake City outside of the state health department. Nick, what's the latest out there?
Well, Emily, the latest is this. The state epidemiologist says the reason we're seeing record-setting hospitalizations, not enough Utahns are fully vaccinated. And today we heard from Intermountain Healthcare. They say nearly 2/3 of hospitalized COVID patients are there because they're not fully vaccinated.
Utah reported a record number of hospitalizations yesterday.
Across the Beehive State, record hospitalizations for COVID, leaving emergency rooms full. This amid a continued crush of demand for COVID testing.
We're actually seeing people who are willing to pay for an ER or an emergency department visit just to get a COVID test, even though they really don't have a lot of symptoms or severe disease.
State leaders have urged people to stay home instead of getting tested. That's to relieve the pressure on those test sites. And that, according to our state epidemiologist, means we're likely undercounting the official number of COVID cases now.
We're definitely still seeing huge numbers of cases.
Today, we asked Dr. Alicia Nolan if, despite this January surge, if Utah's peaking.
It's kind of inaccurate to say we've peaked because I think different parts of the state are in different situations. I think we can be pretty confident and say that Summit County has peaked and has turned the corner. I think sort of Salt Lake, Davis, the Wasatch Front are starting to peak and maybe just a little bit past, but other places definitely are not to their peak yet. They're still increasing.
So if you get COVID, what should you do? It's a question Dr. Wing Province gets all the time. He suggests before you hypothetically were to get COVID, you should get what's called a pulse oximeter. It's a device you wear on your finger that measures oxygen in your blood.
Having a pulse oximeter helps us differentiate those who have severe disease versus more of a mild or moderate case. And so if your oxygen levels are less than 90%, then I would say you should come to an emergency department or call 911.
So that's certainly one way to monitor what's happening at home. Obviously, they say you should be fully vaccinated, get your booster, and obviously stay home if you get sick. But I want to show you one of these testing lines. We've been here in the past couple of weeks. It was 5 hours long. Obviously, a lot of folks are staying home, relieving some of that testing pressure, but Dr. Nolan says right now they are still testing a record number of people. So coming up at 6, when might we get an easier testing process? When will testing be easier to get? That could be coming up soon. We'll tell you when and why possibly at 6 o'clock. For now, live in Salt Lake, I'm Nick McGurk, ABC4 News.